team of researchers at Liverpool University is trialling a health passport for autistic people to help them advocate for themselves at the GP surgery. It's called the Autism Communication Tool, and patients fill in what adjustments they require, what their sensory and communication needs are, and what they want to discuss at the appointment.
The communication tool gives people the opportunity to prepare for their appointment and articulate the reasons for the appointment, and also as well allows that healthcare practitioner to know a little bit about that patient rather than trying to ask the patient to perhaps give more information about the communication within that very time-limited appointment.
This is called the Autistic Communication Tool, or ACT. And let's imagine I'm an autistic person and I'm having chronic migraine. I would go onto the ACT website and I would read the extensive guidance to prepare myself. I would fill in this form. You can print it off, you can take it on your phone, you can use a tablet, you can upload it to Patches or Blinks or whatever new system your GP's got this week. Lots of options. Your practice could even print a load of them for you as a reasonable adjustment. Like I said, it's one page, one piece of paper, double-sided.
There is a section for the reception staff. To hand to the reception staff and let them know if you have any accommodations that you would like for that waiting room environment. And what that does is that functions with an alert really for the reception staff to say, okay, so I might need these adaptations. And it also has a bit on it that says, if I am feeling anxious or I'm feeling agitated, you might see this. This is what I would like you to do to support me. You would take the second bit into your consultation. If you don't feel verbally able to explain yourself, you've articulated on the form what it is you're there to discuss and whether you have any communication desires. If you would like a little bit of extra time to answer questions and you perhaps want the clinician to give you that time before asking another questions, that might be an example of something you let them know.
The tool has a little body map on there as well, so that you can show to the GP, this is where I'm experiencing pain, or this is where the problems are that I'm having.
At the end of the form, there is a next steps section. So it might be the fact that the healthcare professional has let you know that perhaps you need to come back for a blood test, or perhaps you need to book in for a blood test, and there's an opportunity to write that down.
A lot of the time, I've been in an appointment and I forgot what quite was said. Like I was there, but I wasn't processing. So I really like that it's got that written down as well for me afterwards, because I will absolutely forget what was said.
And we recognise that healthcare professionals are under an awful lot of pressure. They're expected to see more patients, given shorter amount of time. Particularly in primary care, they can't be specialists in everything. We were very, very mindful, no, in order for it to work, it has to be short, it has to fit in with the systems now, not require any extra training. It has to work for both the clinicians and the patient. We really do have a view to this being a national form, recognisable, so that when patients took it into their primary care appointment, the clinician, the healthcare professional knew automatically, oh, okay, I know exactly what to do with this.